Irina Strunina, and this is our podcast, Diabetically Speaking with SmartMove360. We are going live every Thursday at 4 p.m. Eastern Time, and we are talking about everything about diabetes with healthcare professionals. So let's go. All right, let me bring my guest. Hello, everybody, again. This is Irina Strunina and my guest, Alexandra François. She is my new friend that I met with when we were getting ready for our Diabetic Healthcare Expo last month. And she been a great speaker. She had a presentation. And I would like to ask Alexandra, let us know why you are the speaker, why you are interested in diabetes, and what is your story? How did you become who you are?
Yes, ma'am. Hi, Irina. Such a pleasure to be with you. I'm super excited to be talking about diabetes prevention and really, honestly, maneuvering through the lifestyle, right? Once you've been diagnosed, how to tackle it head on and overcome the diagnosis. I am super passionate about chronic disease prevention. Being able to provide information and instill knowledge about fighting against chronic disease and how to, like I mentioned, prevent it, right? I started off at a very young age working in sports medicine and
Mhm.
exercise physiology, training athletes. And so I was an athlete myself. I played basketball, soccer, and volleyball. And so
Mhm.
I was very active and started working out when I was 15 years old. The second I started working out, I fell in love with it. And fast forward, I just never stopped. When I got into my career, college, I decided to take it all the way and learn about exercise physiology and exercise science. And as I became an adult, I fell in love with working with everyday people, especially being here. I live in Baltimore, Maryland, and being around a lot of African Americans, which is it's a 63% African American um, city. It's very black city, and so I was learning about public health and I was learning about chronic disease prevention, and I became very passionate about helping people overcome this thing, especially when we're talking about diabetes mellitus, right? And so my father was pre-diabetic in 2020, and we almost lost him in a diabetic coma. He was in a coma for 14 hours straight.
Mhm.
And it was the grace of God that he walked out of that coma and walked out of the hospital. And I knew that with his circumstance, I was going to devote and commit to put my whole entire heart into fighting this thing. We were able, Irina, to reverse his pre-diabetes diagnosis in just 2 months of shifting his entire lifestyle. They're in North Carolina. My parents are in North Carolina. I drove down there. We shifted the way he thought about food, the way he was eating, his behavior changes. Even when it came to his lifestyle with how active he was, he became more active. And it was a drastic shift because he went from doing not much to all these changes that, of course, helped him reverse his diagnosis. And so I made a commitment to not only help people tackle, like I mentioned, this thing, these monsters, but to also be an advocate for it as well.
Absolutely. Thank you, Alexandra. Thank you. This is a great story. And congratulations to you
Thank you.
because being able to influence parents
Mhm.
enough that they listen what you are recommending, it's a
Yes.
challenge on its own.
It
Same
is.
thing working with your children.
Yeah.
It's a very similar challenge that many people are experiencing. So I'm glad that he helped you to show your expertise and participated. And now when he sees the results, it's great that he has that experience. And I think, did it help you to get closer with your parents when you were working on it, or pull you apart?
Well, they knew me to be the fitness guru from the very beginning.
Uh-huh.
And so it just growing up, I kept emphasizing the importance of eating well and exercising, and I always wanted to bring them with me to the gym. They never wanted to
Yes.
go, but it
Uh-huh.
did. One of the things that it did do is it highlighted the importance of living a healthy lifestyle, and that
Yeah.
was everything to me, right? Because um, I desire children. I desire to be married. I want my parents to be around. I want them to be
Yes.
around for all of that. And so I emphasize to them, I love you guys. I need y'all to take care of yourselves. And of course, that was during the pandemic as well, right? The pandemic had just started. And
Yes.
for me, it's all about longevity, being able to live a full life, to experience your life at its most at its fullest. And that, I think, for my parents, it opened their eyes to see, okay, yeah, we need to actually take care of ourselves. And
Yes.
thankfully, my mother, she was more so into the healthy eating. And my dad, we always had a garden too. We
Hmm.
always ate, they're from the islands, they're from the Caribbean, so we always ate like organic raw fruits and vegetables.
Yes.
But we ate a lot of the rice, a lot of the plantains, a lot of the fried the meats. And so it did shift their perspective on their nutrition and overall their health.
Absolutely. Well, several times you already mentioned the lifestyle change. Let's talk a little bit about it.
Yes.
So, uh, I've heard it multiple times when people say that diabetes is a lifestyle disease.
Mhm.
So, why people call it this way? What will be your perspective on it?
Yeah, I believe um it being mentioned as a lifestyle disease is because of the fact that your lifestyle impacts this disease tremendously, right? Um, we know that one of the major factors going into symptoms and factors going into diabetes is sedentary lifestyle,
Hmm.
obesity, right? If you are not taking care of your body in the sense of how you're eating, if you are not being physically active, your likelihood, the chances statistically of you being diagnosed with a chronic disease is very high. You're looking at, 60, 70%,
Yes.
probably even more. I believe sedentary lifestyle is it's a killer. It truly is
Yes.
a killer. When we're talking about sedentary lifestyle, we're talking about not moving
Yes.
enough, jobs where you're just at the computer all day. You're not really getting up to go walking. You're not really, there's not a lot of physical activity. There's not a lot of mobility going on in your day. And so um, it influences the your overall health. It influences, especially with diabetes, because type 2 specifically, one of the major factors is the sedentary lifestyle. And now when you're looking at obesity, right, when you're looking at the waistline overall, the more fat we carry, the visceral fat we carry, the worse the worse it is. The chances of us um, being diagnosed or accumulating a hypokinetic disease is very high. Lifestyle is how you are living your life on a daily
Yes.
basis, right? What are you eating? How often are you exercising? Even we can go into, it's a holistic approach, because we can also talk about your environment, right?
Yeah.
Workplace environment, home, how's your home environment, your relationships, your community? Do you have community? Do you have friends you can talk to? Do you have, we see during the pandemic, we noticed that it's very important to take care of our mental health and to
Yes.
prioritize our mental health as well. So it's a very holistic approach. It is your lifestyle that influences chronic disease for sure.
Definitely. And
Yeah.
when you're talking about this um, s- s- style of living, when we are sitting in front of the computer and not moving much, well, this quarantine that we were forced to follow actually really made all the matter worse, because such businesses as drive-through become more popular. Such
Yes.
businesses as deliver the food bloomed during the quarantine, right? Such businesses as the laundry, when they pick it up from you and bring it back to you when you don't leave the house.
At all.
The I lived when I during the quarantine. I lived in the community, the townhouses, and so you see the neighbors, you see what's going on, right? It's not standalone, and it's not multi units apartment. So you see every unit here. My neighbors every single day had food delivered to them.
Yeah.
This was crazy.
Wow.
It's, I could understand to have a dinner once in a while. I could understand to have, I don't know, lunch when you're on meetings and you don't have time. But starting from breakfast, lunch, and dinner, Dunkin' Donut tray was staying next to their door every single. I would go for a walk. They have the delivery cart pulling in, bringing them the tray from Dunkin' Donuts. So this is just crazy
Mhm.
how easily but it all makes our life easy, and we are so inclined to take it easy, right? So
Right.
what is easy.
Yes, no, yeah, you are so right about that. During the pandemic, it heightened our thirst for convenience, right?
Hmm.
That's what
Hmm.
fast food is. It's all about convenience. We're
Yes.
a convenient. We want conveniency as people here in the Western Hemisphere, and it's killing us. It truly is
Yes.
killing us. And like you were saying, for me and my best friend at the time, I was staying with a roommate, and I told her that I said, listen, we're not going to die. So, what we're going to do is what I know best, and that is we're going to exercise. We were outside almost every single day at the park, and we were intentional. I've already cooked my meals
Yeah.
just about every day. I cook Monday through Friday. If I do go out, it's usually Saturday or Sunday. And I try to limit, going both days in on the weekends. And we shifted our lifestyle. I was already eating well and exercising, but she got a taste of what it feels like to live a very healthy and intentionally healthy lifestyle. And she never got COVID, thank God. I got it one time, but she never got COVID.
Lucky
Yeah.
her.
And so, yeah, and we saw that, and we saw an increase, right, of a lot of your hypokinetic diseases like diabetes. You saw an increase of heart disease even after and post pandemic.
Yes.
Had many, as a certified personal trainer, I've been training now for 13 years. I had a lot of clients. It was a great time for me
Yes.
because they were, quarantined. They were stuck in the house for hours every day, really all day, every day. And they were gaining so much weight from the sedentary lifestyle. And
Yes.
so it is so important that we're moving, so important
Hmm.
that we're moving and eating well. Yes.
Absolutely. All right. The question I have here is, you already partially answered it, but let me repeat it again for those who maybe missed the first part of our conversation. So, how can a change of a lifestyle can change the progression of the diabetes?
Yeah, yeah. The second it is so drastic of a change how exercise influences and how our body responds overall to exercise.
Mm-hmm.
Such a drastic change. The second you start exercising, it releases certain hormones like dopamine, serotonin. These hormones help with not only our mood and how we view just everyday life overall, but even when it comes to apart from the hormones that are being released, even just overall our functionality, our
Yes.
ability to move properly, right? Um, and it also influences our appetite. That's the
Mm-hmm.
biggest thing. So out of 100%, 80% of living the proper lifestyle and being healthy is what you eat and how you eat. The second you shift your eating habits, everything changes internally. Your homeostatic imbalances go back into balance. Now you're able to cognitively be more aware. You have more energy, and when we're talking about metabolism, right? Now we're able to burn more calories. Now we're able to just see the real fat shed off of us, right? Our metabolism is the secret sauce to being able to be our fittest, right? The higher our metabolism is, the more we burn, of course, the more weight we lose. And so it's very important that we are in correlation to your question. It's the second you make those changes, it's literally a sudden improvement that you start to see, not only in the physiological aspects of your body and your body composition, but even how you feel. Even how
Yeah.
you feel. Yeah.
Definitely. You know,
Mhm.
it's interesting. You just reminded me. Yesterday, I had a conversation with a friend of mine. She has diabetes and
Yeah.
she is trying to make those lifestyle changes. And she knew that she was pre-diabetic for a while. So it's not that it's new news to her.
Yeah.
Uh, but she was kind of like not paying too much attention to it, and the longer we go, the worse it may get. So she decided that it's enough of that. She needs
Yeah.
to take control over it, and so she's watching what is going on. She's checking her blood sugar more often. She is monitoring what she is eating, all this. And a couple of days ago, she said that she went along the everything day by day goes the same, but on that day she went out and did some work in her yard and came home after working in the yard. Right now it's summer, it's pretty hot. She came
Yeah.
home being very tired, and she checked her blood sugar, and it was 30 points lower than it was before she went out.
That's
Just
good.
this, not really physical exercises such as going to gym, but it's still activity. You move,
Yeah.
you bend down, you pull up, you take, some stuff, carry stuff around. That is physical activity that
Yes.
helps you and everyone who needs some movement. I don't want anyone to miss that opportunity. This is my activities. This is my physical activities. I need to do that. Let me just today, instead of going to gym, do that in
Yeah.
more intensively.
For sure. Physical activity is in court, like you said, Irina, it can be yard work. It can be instead of taking the elevator, going up the stairs. It can be parking further away at the grocery store so that you're walking longer distance to the grocery store. People think that it has to be actual exercise, though exercise is also very beneficial. But the difference between physical activity and exercise has to be structured,
Yeah,
repetitive, right? Movement. But physical activity, yard work, let me tell you something. Yard work is a workout.
exactly.
Yeah,
Yeah,
hard work is definitely a workout. Gardening is good. It's good for you. And as long as you are moving, period.
hmm,
Moving, period. I tell my clients all the time, I tell people who come to me and ask me for my expertise, I say, just move. Be intentional about moving. Don't be still. Don't be sedentary, and focus on how can I move more than I did yesterday.
yeah,
Getting at least, I tell people, because 10,000 steps a day, that can be a stretch for most people. So
yes.
I say more than 5,000 steps.
Hmm.
If you get 5,000 and then you notice, okay, I can do 500 more the next day, do 500 more. And then you gradually increase and you gradually increase until you can get to 10,000 steps a day. But more than anything, it's just about moving. It's just about moving.
You see the name of my company,
SmartMove
SmartMove360.
360, yeah.
Yes, you do need to move. You need to make those smart moves so
Yes.
they could help you. And, when we were thinking, just brainstorming, what kind of movements you could do, right? Yes, the yard work. Yes, walking with the dog or whatever pet you have, right? Um different activities as biking, swimming, all this is playing in the pool with kids or without kids could work, but also going to take dance lessons.
Yeah.
And this is not going to gym it. You are having fun. You also listen to some music. You challenge yourself to learn the new moves. This is a workout.
Oh,
I
yes.
I was taking the dancing lessons, and that's a workout, especially when you're just starting.
It truly is. It truly is. And for those who, like, for me, I don't know, you're not gonna ever see me on a treadmill or an elliptical because I don't enjoy that. But guess what I do enjoy? I
Yeah.
love playing basketball. So I can
Uh-huh.
play hours of basketball. That's my cardiovascular for that day, right? My cardio for the day. Cardiorespiratory health is so important when you either have diabetes, pre-diabetic, because you want to increase and better your cardiovascular and cardiorespiratory health overall, so that
Hmm.
you're strengthening not only your lungs, but you're strengthening your heart. You're
Yes.
strengthening your heart. Yes.
Yes. Okay. We can talk for longest while. I know we already had those multiple conversations with you and we cannot stop, but we are coming to the end, and I have to ask you a question. What, somebody got diagnosed, they got this diagnosis, they didn't get much instructions, they don't know what to do. What will be your one tip for that person who doesn't know where to start, because it's overwhelming. The fact itself is overwhelming, but
Yeah.
then when you start thinking about what needs to be done, it's overwhelming as well. What would be your one tip for those people who need to start to
To
do
start,
something?
that's a very good question. I always tell people to seek help first, obviously, right? Seek
Mhm.
help, whether that is speaking with if you've already spoke to your physician, because your physician will be able to give you all the information and knowledge that you need to know about your diagnosis. I would suggest to also speak to a certified personal trainer.
Mhm.
If you're able to speak to a certified personal trainer, they can put together a fitness program for you that structures and helps target specifically what you're trying to overcome, right?
Mhm.
And if you're available, or if you're able, more so, most healthcare insurances cover, and they have that availability to go speak to a nutritionist or a dietitian. I
Yeah.
also would suggest to go speak to a certified dietitian or a licensed dietitian and certified licensed nutritionist, so that they can help you with the eating portion, right?
Mhm.
Putting together a unique and a special meal plan and meal prep for you that will help you be very intentional about how you're consuming food, and even giving you the knowledge about food, because there's a science behind food that I think most people don't know about. And
Yeah.
so the more information you have, the better. With this thing, it's all about the information. It's all about the information, making sure that you're inquiring about, okay, what is this? What is diabetes? How can I tackle this thing? And know that, especially if you've been diagnosed with type 2, know that you can overcome it. You can reverse
Yes.
it completely. It
Yes.
just takes action and intentionality. Action and intentionality. And I also would suggest, one of the last tips I would suggest, is a community.
Uh-huh.
Getting around people, letting people know your trusted 2 or 3 people, to hold you accountable and to do the journey with you, to say, hey, this is my reality and I need you to help me to
Mhm.
push me through this thing. And you'll be surprised. Some people will come on the workout journey with you, the fitness journey with you. They don't even have to be on the exact same path, but they can be like, you know what? I'm willing to, work out with you 3 days a week, or I'm willing to, help you cook and do your meal prepping 2 days a week. The community is so big psychologically. It keeps you optimistic. It keeps
Mhm.
you, when it comes to overall, that motivation. And I know this sounds like a complete opposite of and contrary to what most people would say, but it keeps you enthusiastic, because it's like,
Yeah.
okay, I've got bad news, but guess what? This bad news doesn't have to stay forever.
Mhm.
It's not my forever reality. So those are my top 3 tips I would suggest.
All right. Well, you gave more than that. I didn't count, but thank you for this, because
Mhm.
You see, here's the thing. I look at it this way. Um, there are so many ways to approach,
It is.
and I think your main message that I think what I've heard is speak with an expert. Speak with the expert who can provide you with information, who will provide you, will educate you,
Yes.
because this is important to start somewhere, and it's hard
Yeah.
to start when you don't know what you're dealing with. So
Yeah.
find out a person who can help you with initial information and
Mhm.
then expand on it. You don't have to learn everything at once, but
Yes.
one little thing after another. And talking about community, this is what our Facebook group,
Yeah.
Diabetes 101 for Beginners, is. I am so grateful for people who are joining our group, who are asking questions, because some people don't ask questions. They just join the group and they're afraid to put out the question that they have,
Mhm.
and then they suddenly go see, oh, thank you such and such for asking it, because this is my question too. So they could learn along with others. And then the other great side of our group is that those people who joined it a while ago, they got some results, they learned a lot, they
Yeah.
are getting better, and they don't leave. They stay there to help the newbies. So they
Exactly.
are sharing their findings and their discoveries. And I am so thankful for them, for their generosity, and that's a community, one of the communities that are available out there, right?
Yeah.
So
Yeah. Community
perfect.
is big.
Yes, and it's growing, and it's growing, and I'm thankful for my admins who are helping me day in and day out. We have people practically 24 hours a day monitoring group and helping out.
That's
So
awesome.
we are really tightening up. Alexandra, a question for you.
Yes.
We spoke with you for 27 minutes already. And somebody may say, I need to hear more from this lady. She knows quite a bit, and this is exactly what I need to know, how they can connect with you. What will be the best way to connect with you?
Yes, for sure. I am on social media. I'm on Instagram, Facebook, LinkedIn, and on YouTube. We're on YouTube as Faithfully Fit Training, but you can also visit my website to speak with me directly. www.faithfullyfittrainingllc.com. You can send an email, and our response is very quick. I get actually the emails directly, and I will be more than glad to connect with you and answer any questions that you may have, or even
Perfect.
provide any services that you may need.
Perfect.
Yes,
Thank you. Thank you. And Alexander, please remember to go after the show to the Facebook group and type in your uh, website one more time so
sure.
people will be able to find you. And
Yes, ma'am.
thank you. And so right now I have real quick to remind everyone about what is happening in our Facebook group, Diabetes 101 for Beginners, on a pretty much daily basis. On Mondays, we have little motivational talk from Monica Henderson. She is our agent of change, and she is helping people to start making changes. On Tuesdays, we have Telenurse Tuesday, where our registered nurses go and go in a group and answer your questions. It's not live shows, so you can type it in early in the day, and then at 7 p.m. Eastern time, they will go in, go over the questions, and type the responses back. On Wednesdays, every other Wednesday, we have support group meetings that are happening at 7 p.m. Eastern Time in Zoom, where our members could log in and ask their questions directly. Very often, we have registered dietitians, life coaches with us, so they are helping us out to give direct answers right away. Of course, we have our show, Diabetically Speaking with SmartMove360, every Thursday at 4 p.m. Eastern Standard Time. And on Friday, our own Trevor Brown hosts Fitness Fridays at 9 a.m. Eastern. He goes live into the group and gives different tips and ideas how you can start moving, how you can implement movement in your everyday life, right? One more thing that I need to remind you, no, this one. Oh, I have to change the banner. We have the diabetic healthcare expos that are happening every other month, the last Saturday of the month. So the next one will be on August 31st. And please, don't forget about it. Mark your calendars because we going live into our Facebook group, and everybody. You don't need any passwords or anything. You just be in a group and click on this live feed. With that, we are wrapping up. Thank you, Alexandra, again for
Thank
joining me
you.
today for this conversation.
It was so great. Thank you so much for having me, Irina.
Thank you. Good luck to you on your events that are coming up, and we will meet next time, next Thursday. Have a great rest of your week.